Hey, this is Dr. John Galeska, and I'm here to make a little video with my dog, Ellie Mae. And this is the cutest dog in the entire world. I have 5 dogs. This one is a Chi-Chi Boo Boo Goober, and she has a really fast tongue. You have to watch out, she'll get you in the mouth or in the nose sometimes. But with her little 2 tan spots above her eyes, she always looks like she's got her eyes up, like she's asking a question. So she is one cute little dog, and she brings a lot of joy into my life. Dogs have a lot of facial muscle that is movable, unlike horses. So dogs can express a lot more emotion that we can read, and they can read us as well. They have a lot of expressive possibilities. And so I just wanted to introduce her to you. The area around the eyes, from about the bridge of the nose up to the eyebrows, is an area of musculature known as the orbiculus oculare. And the orbiculus oculare are part of the facial muscles that reveal um, that reveal your emotions to the person or other species that you're relating to. And anyway, this is Ellie Mae. So thank you. Kaylee, would you? Oh, there she goes. Oh, okay, bye, Ellie Mae. All right. So you have an assignment coming up, what's called the mock psychological assessment, in which you have to select a character, a well-known character from a movie, to do a false assessment on. Some of you have asked me why you couldn't do it on each other. There are ethical considerations for that. First of all, you're not trained or supervised enough at this point to be able to do that. Now, some of you may be. You may have experience that I don't know about, but in general, I have to assume that you don't have any experience with assessments, so there are ethical problems with that. Hence, the fact that we're going to do a fictional mock assessment on a movie character. So, the first part of the assessment says 5 to 7 pages, not counting cover sheet and reference page. Use single spacing as in the sample in the text. Everything else should be APA. Uh, now, there are a couple of very specific things that I want you to include in the first part. You'll note that on page 158 it has a format for the presentation, and it has as the first section, reason for referral. In this, I want you to very, very precisely tell me the explicit and implicit referral questions. If there is no implicit referral question, make one up. Um, you're going to be doing a lot of fictionalizing through this report anyway. For instance, with Dustin Hoffman's character in Rain Man, his brother's motivation could be that, and an implicit question could be, is Raymond capable of handling his financial resources on his own? Does he need a trust, someone to form a trust for him to take care of those? And at the beginning of the movie, I think you might sense that Tom Cruise there, his brother, has possibly some ulterior motives in what he's doing with Raymond, seeing as how he's just inherited a great big bundle of money. So implicit questions are things that are unspoken, but yet run beneath the surface. If you can't find one, make one up for the referral. And the explicit questions are in Rain Man's case, Dustin Hoffman's character, Raymond's case, the explicit question is going to be, can he survive outside of the institution where he's presently living, or is that the best placement for him? Be creative. Based on the movie, you can come up with a lot of ancillary, implicit, and explicit referral questions. Include those. Also, let us know who's going to be paying for the report, who is providing the source of financial reimbursement for your efforts in this case. If there is a forensic component to the report, it is possible that a judge could have ordered a psychological assessment for an individual. In that case, you handle things a little bit differently. Your informed consent and confidentiality statement would be modified according to the need to report to the court and stating the mandatory nature of the referral. And one of the most popular assessments in a forensic type referral is the MMPI. Very, very often used in forensic referrals. Okay, you've got implicit, explicit referral questions. Please include them. Make them up. Make them appropriate for the character that you've chosen. Make sure you specify who is paying for the report. Let us know if there's any aspect of mandatory reporting in a forensic sense. Okay, that's the beginning reason for referral. Now, background information. In your very first section, reason for referral, be sure you mention a review of records. In doing a review of records, you're going to have to get a signed release from perhaps previous doctors and from your client as well, stating who information can be released to and in what form. Okay, can this information be in an encrypted email? Does it need to be presented on paper? Confidentiality has to be protected. Do specify that there will be a review of records and that the required releases will be taken care of before this whole thing takes off. Now, the review of records could start your next section, which is called background information. There may be a criminal background in some cases. There may be prior hospitalizations. There may be incidents of periods of outpatient care from a previous therapist. Sometimes these things are in the movie, sometimes you just have to guess at them. Sometimes there are divorce proceedings that have to do with the psychological well-being of the client that you are going to be doing an assessment on. Take these things into consideration and report on them. There's plenty of stuff for your imagination to key on here. So review of records, got to be there. Now, also ask for a medical assessment. Sometimes if a person is presenting with major depressive order, may have a thyroid problem that can be treated pharmacologically, treating the thyroid rather than treating the synapses with a psychoactive drug. You would want to look into medication history as well. So medical examination, recommended. Have one done, report some results, give a medication history as well. And this is all in your background information. Now, you're going to have to choose, you're going to have 4 procedures. One procedure is going to be your unstructured interview, which will be the first one. 3 other procedures should be chosen. One of them can be a mini mental health status exam. There are formats for these online. They're very commonly used in crisis intervention or by field workers who are working in an emergency situation. It is something that it would be good for you to be familiar with. You could start with that if you'd like for almost any clients. The beauty of these is that they can be performed within the context of an unstructured interview. Now, you're going to need 3 more procedures. These procedures should be incremental in their utility. In other words, things shouldn't overlap. You don't want to use the Hamilton's depression inventory along with the Beck's depression inventory. They both measure depression. One is sufficient. You don't want to repeat an intelligence test, the Wechsler or the one of the Thorndike tests, because that would be repetitive and overlapping and actually a waste of your client's time and your time and resources. These things do take a bit of effort to get done in good form. So your things have to be incremental, meaning that they have to add some information that is unique. The contribution is unique towards answering the explicit and implicit questions. If you suspect learning disabilities, you might want to use the Woodcock-Johnson. If you suspect dementia, perhaps the Wechsler memory scales would be a good test of memory, and that is a test that's often used in preliminary diagnosis of dementia. You might want to use a projective test to try and find some keys for therapy that you might recommend at the end of your report. Projective instruments are, as you know by now, psychometrically unreliable and sometimes not really cleanly valid. However, they do present an awful lot of clinical utility, and an artful therapist can draw a tremendous amount of information from projective instruments like the thematic apperception test, the kinetic family drawing test, the Rorschach, classical ink blots. Whatever 3 instruments you decide to use, they should be listed before your unstructured interview. The first one might be your mini mental health status exam, your unstructured interview, and then you need 4 altogether. Let me make sure what I've written in the assignment here. The sample report shows 9 procedures. You'll have 4, the unstructured interview and 3 additional. So if you have your unstructured interview and your mini mental health status exam, you'll need just 2 additional. If you are unsure of the diagnosis, a good place to be would be with a broad range objective diagnostic instrument like the Symptom Checklist 90. It's a good place to start if you're not quite sure what's going on with your client. Justify those choices. So in our textbook, it has simply a list of the procedures. Supplement that list with a sentence or 2 about why you have chosen that particular instrument. Okay, now you're going to follow this with your interview. Please have some fun with this. This is a fictional thing. Be creative. So much of this course is cut and dry. You have lots of definitions that are closed. You simply have to memorize them. I apologize for the dryness of those concepts, but they are a requisite to understanding concepts like reliability, validity, clinical utility, normative samples, things like that. There are definitions that just simply have to be mastered. So I do apologize for the dryness of those concepts and that the work does seem an awful lot like busy work. I'm trying to get you to be familiar with at least 9 instruments through these the bullet point assignments that you have done. I am open to suggestions on how to accomplish that in another manner. So if you have some ideas about that, bring them on. I'm happy to utilize those in a future course. And people who follow you, if you have some good ideas, will probably be really happy about it. Okay, so you've got your unstructured interview coming up. Now, you might include in this not only the interview with your client, perhaps an interview with a former spouse. In Bob Wiley's case, he was divorced. He said because his wife didn't like Neil Simon. Or you might do an interview with a person's therapist and include what they had to say. Be creative, have some fun with that. Now, after you've done your interview, present the results of your procedures. The unstructured interview does not have to have a formal presentation of results. But the mini mental health status exam, you could say a thing or 2 about it and the scoring on that. And you can find websites that will give you a format for that and a way to score them and interpret them. You can include the results and perhaps an Excel spreadsheet or some sort of a diagram with the results for each section. In reporting the results of something like the Minnesota multiphasic inventory, Um, look at how those results are reported. You could look at Pearson's Clinical Assessments website to find the categories that are reported and the nature of the scores that you have to deal with. So look and see how those things are reported, report them in a table form, then follow that with um, uh, a couple of paragraphs about each instrument, at least one good strong paragraph about each instrument telling what you have discovered. This is followed by the final section on your report, which is a discussion, which will include the answers to the explicit and implicit referral questions. If you haven't done that, you've failed in your assessment, okay? And the person who's paying for it won't be getting their money's worth. So you must answer the explicit and implicit referral questions in the final discussion section. Also, here is where you get to make recommendations for what you think should happen. I know that you don't have enough information academically yet to be able to do strong diagnosis. Some of you may be stronger in that area than others and have more background. If you are comfortable with that, you can go ahead and make a diagnosis. If you'd like, you could use DSM categories, saying that he satisfies category 1A, 1B, and you could state what those categories are and state that the criterion has been satisfied for those and that this individual satisfies the criterion for major depressive disorder or whatever it is. This is an opportunity for you to be creative. And I would just like to say one thing about all of these tests that you've been looking at in the bullet point assignments. Some of these are going to be beyond the category of someone with MFT licensure. However, that there are certain circumstances in which you'll be able to utilize these assessments. You always are capable of doing something that is within your scope of competence, okay? You could become an expert in a certain assessment procedure and become certified by the people who offer that, publishers, to be able to present it. But you are going to find these procedures listed in the case studies and the records of clients that you're going to be working with in the future. So it behooves you to be familiar with them. I hope that helps to explain what you've got to do on this. Please don't be constrained by exactitude. Use your imagination. Do include as many of the concepts as you can from the course. You may mention reliability, validity, clinical utility. You could mention cultural appropriateness. You could mention any of the concepts that are incorporated into the reading that you've done so far. If you have any questions, feel free to email me. Hope you enjoyed meeting one of my dogs, Ellie Mae, and I wonder if you caught that term that has to do with the musculature between the forehead and the eyes. There is an online emotional reading assessment where it shows you people's faces that are masked, and I think it's referred to as an empathy test. You might want to look that up. It's kind of a fun thing to do. It's remarkably hard, even for people who are therapists or have been for a long time, to pick up all of the subtleties of emotional expression in the orbiculus oculare. Okay, all right, take care. Please don't hesitate to email me. Try to have some fun with this assessment.